This is the VOA Special English Health Report. The United Nations is seeking to improve electronic communication for health workers in Africa. Workers in rural areas would have a better way to get training, information, and advice from doctors hundreds or even thousands of kilometers away. In 2005, the World Health Assembly passed a resolution urging countries to plan for e-health services. The idea is to look for ways to use modern information and communications technologies to strengthen health systems. The World Health Organization says Africa is behind other parts of the world in treating HIV/AIDS, tuberculosis, and malaria. So, the United Nations Economic and Social Council is supporting the expansion of telecommunications technology for healthcare workers. Telemedicine is another term for e-health. Steinar Pedersen is the director of the Norwegian Center for Telemedicine at the University Hospital of North Norway. Dr. Pedersen is working with the WHO. He recently met with West African health officials in the Ghanaian capital, Accra. He says the technology can provide easier access to medical specialists and make it easier for people to seek medical information themselves. Elias Sori is the Director General of Health Services in Ghana. He says e-health will offer a way to reduce the effects of health worker shortages and make it easier to train existing workers. Dr. Sori says the technology will also make it easier for doctors at Ghana's main teaching hospital to share their knowledge. Dr. Sori said this would help doctors in villages with difficult cases. They would be able to link up easily with a top doctor in the hospital to get advice. He also said that there is always new medical information, but it is not necessary for all doctors to go to the teaching hospital to be trained and increase their knowledge. He said e-health can bridge that gap, and medical education is one of the most important parts of e-health. Services must be shaped to fit each country's healthcare needs and level of technological development. Another issue is patient privacy. The hope is that health ministries will together develop policies on collecting and storing electronic health information about individuals. And that's the VOA Special English Health Report. Transcripts, MP3s, and archives of our reports can be found at voaspecialenglish.com, where you can also post comments.